Next question is related actually to a topic that comes up oftentimes in various conversations. Is artificial intelligence, machine learning, already changing the way you run your projects, and how do you foresee that going forward?
Yeah, that's a great question. Actually, one of our strongest partnership board members, he's a big supporter of AMP Health, Dave Milestone. He's the director of USAID's Center for Innovation and Impact. And just last week we were having a meeting about AI, and because that part of USAID is doing a lot of really interesting research here. I think that, you know, for so long, I'll speak to Africa because that's where my experience is. So long, many of these developing countries have been sometimes the last recipients of new technologies, and I think, you know, look at you know, smartphones or mobile banking. You know, Malawi didn't you know, establish a full landline system and then go to, you know, QWERTY phones, then go to smartphones. They really leapfrogged a bunch of these technologies, and I think there's a huge amount of potential for these ministries that are really thinking intentionally about how they can be leaders in this space and not just follow the trends of some other larger development partners. I think it's a really exciting opportunity. For example, Sierra Leone is working on establishing, you know, strengthening its data reporting system from the community health worker all the way up to the national level. You know, it's currently done kind of haphazardly with paper forms. They're trying to go like straight to a digital reporting platform because the technological infrastructure is there, and if there's somebody who's willing to kind of push the team to go in that direction, and then there's a pull from the ministry more broadly, I think that's exactly what we're trying to do. You know, help these teams really lead their own prioritization and sort of visions for their countries and their countries' health systems. So new technology is definitely something that we're always open to. I think the AI question is still, I think it's still a bit of a question. I don't think we've figured out exactly the application for a Ministry of Health in any of the countries that we've worked with yet. But I would put a big caveat on yet, because I do think that there's a ton of desire to kind of, you know, not wait and sort of leapfrog some of these other countries if the technologies are there and the will is there to really implement new and exciting, innovative technologies.